clients who are coming in who are pregnant. It really depends on what stage of pregnancy they're at, for what kind of props you're going to need. Let's put it that way. Like if they're early in their pregnancy, they're under 20 weeks, like you can do what you normally do, like, and it's fine. You could do them like, and there's no issue if they're 10 weeks pregnant or 20 weeks pregnant. Like there's no harm done in Reiki. Just listen to your hands, listen to your intuition, and let the Reiki guide you. But once you kind of hit beyond that 20-week point, or especially beyond 30 weeks of pregnancy, you kind of have to make sure that you have additional pillows in your room, and you can use just regular basic pillows. You don't need to go buy a wedge to get them off their back. Like a lot of massage therapists have those, but they are seeing a lot more pregnant Reiki clients if that's what they specialize in. So if you have a random Reiki client every once in a while, you can have probably 3 or 4 pillows on hand, and that should be enough. So if they're late in pregnancy, they can't lie flat on their back because the weight of the uterus will lie on the vagus nerve and cut off their blood circulation to their legs. Of that flow of that major artery vein pathway is going to get blocked, and they're going to get lightheaded. And so that's why pregnant women will naturally roll to their side or going, I'm not feeling well. That's why they're not feeling well and they need to roll over onto their side. And so on their side, because they have so much of their gravitational pull is off center, because they have this giant uterus, like belly growing, there's some things that you can do to help them feel more comfortable. Having a pillow between their knees, having a pillow tucked under their belly, so it's kind of lifted up, so it's more in alignment with their spine, is helpful. So their belly button is more in alignment with their spine. So just visualize that. Sometimes they need an extra pillow for their head, like they need one under their arm. Like they just have a lot of changes going on in the body, and our job is to make sure that they're comfortable during their sessions. When I do Reiki for pregnancy, like I typically will get pregnancy clients to sign up for at least a 3-pack. And I've noticed dramatic shifts with length of labor if they commit to at least 3 Reiki sessions. Now, all the people that I've worked on who committed to 3 Reiki sessions were also my doula clients. So I'd go to the hospital with them, or I think all of them were hospital births, and they were all first-time moms. And I probably had like 5 or 6 of them before the pandemic hit, when I stopped doing this. And everyone had under 7 hours labor. Like my last pregnant mama, she was one that I was like, oh, this is going to be a really long labor. Like I've been in the birth work biz for a long time, that I was like, oh no, she's got a lot of like rules in her head. And if you have a lot of rules in your head and things don't go the way that you want them to go, it can be curious, right? And so basically the last time she had come into session, I was feeling her energy. I'm like, your body's ready. It wasn't her body was ready. It was your emotions and your spirit is now ready for this baby. Like everything's in alignment. And I could feel that. And I was confident about that. When your body is ready, things should go smoothly. Her water broke, I think, 3 hours later, and she went up to the hospital early the next morning. Like she didn't have to go right away. She literally I was teaching a Reiki kids class of all things. I was teaching a Reiki kids class, and she texted me, we've been at the hospital for about an hour and a half. I'm getting my epidural because things are really intense, because she was already like fully dilated in an hour. And you can come up when you're ready. Like she wasn't like urgently asking for me. So I was like, okay, I had a mom who was there with me in the kids class. Like a couple parents had stayed because we had 8 6-year-olds of all things. Like, oh my God, 8 6-year-olds. So I had 2 other parents stay during the Reiki class. And I ran up to the hospital, and the baby was already born like 5 minutes prior. So literally like 2 hours of labor for a first-time mom is like unheard of. But I think every one of my clients, it was 7 hours or less, who really they were committed to doing the emotional work before the birth. And the emotional work was so driven by the Reiki sessions. Like, okay, this is what we need to work on now. How's your fear? Like, we would really go through the emotional layers of what was coming up in the pregnancy and getting all that cleared out of the way, so that when the body needed to do what the body needed to do, it could, and the emotions weren't going to disrupt the natural progression. So Reiki for pregnancy can be super amazing. I highly recommend it.